Process number 5 is tracking. Tracking is the ability to move the eyes from focal point to focal point with smooth, accurate movements. It is also the ability to respond in a correct sequence. Symptoms of poor tracking include difficulty with fluency and skipping words or lines while reading. It can also cause an inability to respond to directions in the correct sequence. One of the major visual skills needed to perform the act of reading is the ability of the eyes to track. During the act of reading, the student's eyes must accurately follow the lines of the text and move precisely from one word to the next. It's surprising that some students don't naturally develop this critical skill. If the student hasn't developed the skill, he may constantly lose his place and skip lines or words. Poor tracking can even cause a student to reverse words such as saw and was, or on and no. This is caused by the eyes slightly overshooting the word, and in the act of moving back, the mind will inadvertently read the word backward. A student who struggles with eye tracking will often use his finger while reading to assist the eyes in tracking the text. The following exercise can be used to assess the ability of the student's eyes to smoothly track from focal point to focal point. This assessment is for ages 9 through adult. We'll be using a small rubber ball suspended from the ceiling by a string for this exercise. This can be created at home by using a tennis ball and a safety pin to attach the string to the ball. The student will lay on the floor with the ball suspended 8 to 18 inches above the nose. Ask the student to keep his eyes on the ball while you swing the ball in these tracking directions. The total swing of the ball should not exceed 36 inches. The student will track the movements of the ball while carrying on a conversation or answering questions. He will track the ball for 30 seconds per year of age. For example, 10 years of age would track for 5 minutes. 12 years of age would track for 6 minutes. Ages 14 and above would track for 7 minutes. The student will keep his eyes firmly fixed on the ball with the head remaining stationary during the entire exercise. Do you have a brother, Hunter?
Yes, I do.
What's his name?
Daniel.
What color is his hair?
Brown.
Do you have a car?
Yes, I do.
What color is your car?
White.
How many siblings do you have?
2.
What are their names?
Daniel and Natalie.
How old is Natalie?
She is 31.
How old is Daniel?
27.
It is essential for the student to keep his body relaxed and quiet during the exercise so you can carefully observe the eye movements. If the student's eyes cannot easily track the movements of the ball for the appropriate length of time, or if you observe jumps or extra eye movements during the tracking, this would be an indication of tracking problems. If the student displays symptoms of eye strain, this would also be an indication of tracking problems. These symptoms would include red or watery eyes, headache, or continual blinking. I would recommend you discontinue doing the exercise if you observe these symptoms. After a few minutes of instruction and practice, the student should be able to easily track the movements of the ball for 30 seconds per year of age without eye strain or extra movements. The student's eyes should be able to stay continuously fixed on the ball with the head remaining stationary during the entire exercise.